I'm Abdulla from Group 1, and today I'm going to show you first clinical scenario. In this scenario, we have Mrs. Tim, who is 49 years old. She has had an abdominal surgery, herniectomy. As you can see, she has an intravenous feeding running. So she has abdominal dressing on the incisions. Also, there is a NPO sign on the side table for this patient. So when checked, his temperature is 36.2 and the pulse is 84. So we got 120 for the systolic pressure and 80 for diastolic. Also, the wound dressing is clean. Also, in the urinary bag, I can see 120 ml of urine, which is normal. The patient is conscious and have a complaint of dry mouth and thirst. Because the patient complained of dry mouth and thirst, I'm gonna offer the patient carbonated water. So now let's discuss the clinical scenario questions. So the first question is, what is herniectomy? Herniectomy is a surgical correction of a hernia by cutting a band of tissues that constitute it. Question is, how much urine do you expect during the next hour? For normal patients, the urine output is normally 1.5 to 2 milliliter per hour, but for post-operative patients, the urine intake would be much less. Also, it depends on the patient's weight. The third question, what does NPO mean? As you can see here, there is an NPO sign there. NPO means nothing by mouth. Number 4. Are actions of the nursing assistant right for dry mouth and thirst? In this case, the nursing assistant action is not right because she offered a glass of water to the patient and there is a sign NPO, nothing by mouth. We cannot give water to the patient without the permission of the surgeon. The fifth and the last question, what should you have done for dry mouth? As you can see, when the patient complained about dry mouth, you have to do something. And when there is NPO sign and feeding is done by intravenously, you cannot offer the patient a glass of water. So in this case, we need to check input and output. If the patient is allowed to drink water, then obviously we can give water to them. But in this case, it's better to give mouth care to prevent them from getting thirst or dry mouth. For post-operative patients, it's very important to assist them if they need anything, and also to check for the vital signs if they have anything abnormal. We have to immediately inform the head nurse or the surgeon.